What is clear from the government is said, this is not a long-term strategy in a sense, but something needs to be done to take immediate action.
I think that's very much the tenor of it. So what's going to happen tomorrow is the government will unveil the findings of its review into urgent and emergency care. Now, there are no easy options here. I mean, what we're seeing last month is that the kind of average waiting times for ambulances are exceeding 90 minutes. That the average wait in A&E is exceeding 4 hours. So the front door of the NHS, which is under unprecedented pressure this winter, but it's under pressure every winter. It is under pressure, frankly, even when it's not winter these days. The front door of the NHS, GPs, A&E, ambulance service, anything that can be done to kind of manage down demand for those services will make a massive difference to the front line of the NHS. So what the government's rationally doing is saying, look, what are the pressures and how can we reduce them? Well, one of the big pressures is the kind of yo-yoing of particularly frail and elderly people into hospital and then out of hospital and what they call failed discharges. So they discharge back to home, and then they may get an infection or they've got a bad chest and they're taken back into hospital again, waiting in the car park in the ambulance and then into A&E and all the rest of it. So if there can be interventions made at that point in the home very quickly, then it will save and protect the NHS front door. And there's two elements, I think, to what the government's announcing tomorrow. One is these kind of virtual wards. So it's, politicians love talking about technology, but it's about being able to monitor people in their own homes and to be able to sort of assess how they're doing and how they're coping. But also having kind of rapid reaction teams of nurses and multidisciplinary nursing professionals, so physios and people like that as well, that can get into homes very quickly within 2 hours and make interventions that hopefully prevent ambulatory care having to call an ambulance effectively and taking somebody to A&E. And of course, we've got an ageing society and we've got lots of people that don't have great support at home and don't have family nearby and all of that. So these are pressures of a modern society as much as anything else. And the NHS is probably not brilliantly geared up to being able to meet some of these challenges. So this is an attempt to address that problem. So we've had a pilot of about 10,000 people last month accessing these kind of virtual wards and these rapid reaction teams. And what they're going to try and do is step that up to about 50,000. But of course, the obvious question is, it sounds like a good idea and a sensible idea. So why has it not been done before is probably the obvious point.
As so many of the things that could be done, actually, why wasn't it done before? I mean, I think you're absolutely right, Kevin, when you talk about people, particularly the elderly and the vulnerable, who would much rather be at home rather than in a hospital that can be noisy and there can be so many distractions and things going on all the time. So being at home is the idea. But that comes back to having a social services system that works properly and having the staff to staff it. So there are two problems there, aren't there? Haven't we got to sort out social services, which Jeremy Hunt was always trying to do but never could? And we've got so many nurses and medical staff now on strike. And how are we going to get the balance right so that this is going to work in people's homes and they are going to feel that they're getting the kind of treatment they actually need and not just being sort of shuffled aside and not being given the opportunity to go to hospital?
I mean, you're quite right. I mean, this is like a giant jigsaw puzzle that you're trying to put together. There's an element where it's about acute care in hospital. There's an element about what they call step-down care. So you don't need to be in a hospital setting, but you're not, you need support. And then there's a longer-term social care element as well, because of, we face an aging society and all the pressures that brings. And these pieces just don't connect together desperately well. And we've been talking about this, in British politics for quite a long time, really. And there are elements where this does start to work, but we need to see a lot more pace and urgency pushed into these proceedings. So we've got issues around the financing, obviously, of social care, which is a huge political issue. It scuppered Theresa May in the general election in 2017. I remember Andy Burnham as the last Labour Health Secretary back in 2010, making a pitch for the Labour leadership at that point, talking about this issue about social care. And I think people looked at him then and thought, what are you on about? This doesn't feel like a pressing issue. But of course, it really, really is a pressing issue, because it's draining resources from the NHS. And we've got a lot of money spent in this area, but some of it not spent desperately well.